Hi, welcome to the Upgrade Your Healthcare series. I'm Dr. Bhavna Rao, founder physician of Meridian Springs Primary Care. We are a direct primary care clinic serving the Woodlands, Tomball, and surrounding areas. Today, we are going to talk about CleverRX. Just a disclaimer that this is for informational purposes only. Our goal here with these interview series is to create a more informed healthcare consumer. Now, what is a direct primary care clinic? This is a clinic where it offers its members unlimited clinic visits, no co-pays or visit fees for a flat monthly fee. We also include telemedicine and virtual visits for the membership. Today, we are joined by Brett Cunningham from CleverRX. Thank you for joining us, Brett.
Yeah. Thanks for having me. Appreciate it.
Would you like to tell what CleverRx is about and the story behind the formation of CleverRx?
Yeah, for sure. So CleverRX, we were founded a few years ago, and our whole intention was to provide access to prescription medication at affordable prices. A lot of people don't realize that just because you have insurance doesn't mean that's necessarily the best way for you to get your medication. And now we're seeing a rise in a lot of people without insurance and taking other, non-traditional routes. Maybe having a direct primary care rather than a traditional insurance program, things like that. So people are being better consumers, and we wanted to position ourselves to make it really easy for our users to access affordable medication. You can use our app, you can use our website, you can find discounts on prices, and then go to the correct pharmacy and get them for sometimes 80, sometimes even 90% off. So that's really why we intended to build the company. And like I said, we've been in business a couple of years now, so very much a healthcare startup, and really focused on just bringing more value to the healthcare community.
Awesome.
What is the difference between a prescription card and a discount card?
Yeah, good question. So there's different ways of doing it. So I guess historically, people have always gotten their medications like showing their insurance card, and it will show you your copay. And back in the day, most copays were pretty inexpensive. That world has kind of changed. Prescription prices have been rising. More and more people are uninsured, and a lot of healthcare insurance companies are scaling back what drugs they're covering for what prices. And so these discount prescription cards like CleverRx are really intended for the cash paying customer to provide discounts. Their main purpose for the actual pharmacy is to provide loyalty to the customer. Almost think of like a normal discount that you would get like in a coupon for your groceries. You're going to go there to get that coupon, but you're also going to buy other items as well. So that's kind of the same concept with the discount cards. There's different types of discount cards out there. We're more of a general one. If you go to like maybe a really expensive name brand, name brand drug, they're going to have copay cards that can help you pay for some of those expensive medications. We're not like that. We really have a really broad number of scripts, over 55,000, and we work with pretty much every pharmacy out there to provide discounts. So I know it's kind of a long answer, but there's different types, and we're really just kind of a core RX card that's going to provide up to 80% prescription discounts on pretty much every drug that you could possibly need.
And I also have noticed that these big name brand medications, their discount cards only apply for people with insurance.
Yeah. And so that's where, we would like to find a partner where we can eventually get into that space. Ours is working for everybody. And that's kind of the big thing that we want to focus on, especially for your patients out there. It's really important to know, whether you have insurance, whether you don't have insurance, you need to present the discount card to the pharmacist just to see. I've had people come to us with testimonials that said, I have insurance and I thought I had really good insurance and my medication was going to cost $100 this month, and I used CleverRx and it was only $20. And so that's the big thing that we're trying to change the behavior is, even if you have insurance, if you don't have insurance, always look for a discount. Use CleverRX, present them with the card, and you'll be surprised how often you save.
Yes, absolutely true. And I've said this to my patients, even generic medications, like, for example, metformin, which is a very commonly prescribed medication. There are a lot of insurances which they say is covered. It's a tier 3 medication, and then it's $10.
Yeah.
But in fact, it's much lesser than $10 when you go pay cash without your insurance card.
Yeah. A stat we like to put out there: over 40% of our medications are under $10. So it's really hard to find a copay that's under $10 nowadays. So just take a couple minutes. We try to make it as easy as possible for them to use it. And $10 to some people isn't much, but to a lot of people it is. And I think with what's going on right now, it's important to save money wherever you can.
Definitely. And I'm going to share the screen now to show the CleverRX website.
And the great thing about this website that's going to come up in a second is this is exactly like plugging in some name on Amazon and shopping for different prices. It's the same thing, but there are different vendors that are offering that, and it's the same kind of experience. And I don't have the number handy, Brett, but I believe we have saved our patients probably a couple of $1,000 over the last 1 year.
Yeah.
Something like that, I guess.
Absolutely. Yeah. And that adds up at $30, $40 at a time. So
yeah.
You definitely help a lot of your patients save. And that's part of the reason why a lot of physicians like yourselves are partnering with us. It's nice to see those numbers and actually see the program work.
Yes.
A lot of the discount cards out there, you can provide it to them and you don't really know if they work unless you get feedback from the patient. We're at least able to show you actually how much you've saved your patients.
Right. I'm trying to share the screen. Sunil, I think you need to click on some to allow me to share the screen.
Okay, I think you can do it now.
All right.
All right.
So I have here the CleverRX /Springs, CleverRx.com/SpringsMD. And this is how the website looks like. Anyone visiting this can, or our patients can put their phone number in and get the text the app to themselves. And also there is a price lookup for comparison. Say, for example, here, let me throw in a common antibiotic.
And it should pop up there.
Yeah, and it pops up. So select that and our zip code and click search here. In a few seconds, it's going to populate the cost of the medications at various pharmacies around me.
And one of the things I want to point out too is that we've put a lot of the time and energy and money into the app flow, and we think that's definitely the best way for you and your patients to really experience CleverRx. The website is there for people who aren't as maybe tech savvy, that doesn't have a mobile phone for downloading apps. Most people do, but I would recommend that to the patients is download the app. It goes a lot faster. It's a lot more user friendly. And I think you'll get even more benefit out of the app. But this is good for purposes of today.
Yes. So I put in azithromycin, and here is the list. We have a $8.37 at HEB pharmacy versus again here $12 at CVS, $12.89 at Kroger, $19.22 at Walmart. So there is definitely a big price difference.
And this is the same medication, right? So there's no difference between what these guys are selling. It's the same medication, but the prices are different. And you see all the list of these prices. And basically you pick and choose the lowest cost and buy it from there through this card.
Yeah.
So the app also can, once you download the app, it has a way, it saves all your medications, and you don't have to try to look for it again and again. You can save your prescription list into the app, and it will, and usually you can check it every 2-3 months. I believe Brett, the pricing changes in pharmacies. Do you know how often, or is there a average period that people have to look for?
Yeah, no, it's a good question, and that's one of the things that kind of separates our program from others. We have direct contracts with the pharmacies instead of running it through a traditional pharmacy benefit manager, a PBM, and so our prices don't change as often. Now they still will change from time to time. Ours is more quarterly, and if they are, it's within a few pennies typically. Most typical cards that you use that are on the market that you see advertised on TV, they can fluctuate quite a bit, and a lot of times they can fluctuate almost daily as well. So that's the other thing, and that's why we partner with a lot of the doctors, is that you're able to predict the price of the medication for not only that visit, but down the road as well. So good question. They do change, but not very often on our program.
That's awesome, because some of my patients use other discount cards, and they are looking for pricing every month. And and that's an issue, because you're changing your pharmacies all the time. It's a lot of inconvenience for, if you're on a chronic medication that you need it every month.
Yeah, and that's one of the reasons why we have such good pricing with the pharmacy chains that we do, because they want to instill loyalty. They don't want your patients going to HEB one month and then they move their script to CVS and then they go to Kroger. Those pharmacy chains want to keep you there, and so that's where that pricing integrity comes into play, which ultimately breeds a lot of loyalty.
That's right.
Can you plug in another medication for a chronic disease, or let's see a difference?
We can do. This is a steroid cream, and let's check this.
So it looks like that one's kind of looks like it's pretty close in prices between the three.
Yeah.
The three it's showing.
Yeah.
Well, again, it's and one of the things that we do for every patient, and especially if it's a new prescription, is that I type in the names, I type in its name, look for pricing, and educate the patient, show them that this is what you need to look for a new prescription that we are unfamiliar with the cost of the medication. And
yeah, that's really important, and kudos to you for doing that for your patients. When we talk to a lot of different employer groups, and we really talk about our program, we really feel like that is a fundamental problem with most doctors out there. They don't do this step up front, where they look up the medication, look up the price, and then show you where you should go to get it. So I think what you guys are doing is great. And a lot of people just ask you, well, what's your pharmacy? And then they send it there and let you deal with it from there. So kudos to you guys for taking this extra time to save your patients money.
Thank you.
And the great thing we do is, for patients who already have the card through us, sometimes when they see that it is lower cost in a certain, one place, we send the medication there, which might not be the where we had sent it previously. So depending on where it is lower cost for the same medication, we can move that around and help the patients that way.
Great.
save every month.
Yeah.
Awesome. So
I had another question. See, there are different discount cards in the market that's available.
Mhm.
So what makes CleverRX different and better?
Yeah, I touched on it a little bit with the direct price contracts with the pharmacies. I think
Uh-huh.
that's something that's really important for the consumer standpoint, is that when they use CleverRx, the price has been negotiated directly with the pharmacy chain. Therefore, you get a lower pricing, especially at the large chains like the Walgreens, the CVS, the Krogers, Walmarts. Will typically beat the competition about 70% of the time at those main pharmacies. So from a consumer standpoint, that's great. They're getting the best price at the largest chains where most people go. And then, from the way we distribute, it's a little different as well. A lot of the other discount cards spend millions and millions of dollars on marketing on TV, which, a lot of times they have to raise their prices to kind of make up for their marketing costs. We partner with the healthcare community. And so we're able to, I guess, go to market with less out-of-pocket costs so we can supply more savings to the patient, which is really important when you think about kind of the long-term growth of the company. So I guess lower prices, consistent prices, and easy to use is probably the biggest part there.
Yeah, and we love it that, what we stand for is competing on price, because, efficiency is available in every other industry because prices are transparent. But healthcare, for some reason, it's completely absent. But what CleverRx and is doing is making those prices visible, transparent, so people can pick and choose, and it will drive competition and it will drive efficiency overall in the healthcare industry.
Yeah, and we're not going to win every script, and we'll say that and admit that all the time. But if you can get a prescription for lower price than us, more power to you. We just want to change the way people are thinking about paying for their medications, and we're very confident in our program. So we always open up that competition if they want to price shop us. Happy to do it. We just want people to know that there's better options and they can save a lot of money. And sometimes that lot of money is different from somebody paying their rent for the month, or taking or getting a medication for a pet that really needs one. So there's a lot of different ways that we look at it. So do the due diligence and save a few bucks.
Thank you so much, Brett. This was great information and important information, and savings is always welcome for everybody.
Mm-hmm.
So thank you for joining us. Thank you for taking the time and joining us today.
I appreciate it. Let me know if I can come back on about anything else.
Sure.
Definitely. I think we are doing this Upgrade Healthcare series where we are showing them how to upgrade healthcare and also downgrade the cost of care and cost of coverage. And these are all of the things that people need to know, the community needs to know, to for price transparency, shop around for prices.
Yeah.
Where you are getting the best but at a lower cost. That's the best paradigm that we can have in this industry.
Yeah, we'll keep up the good work.
Thanks, Brett.
Thanks, Brett.
All right, take care.
Bye.
Bye.